I recently had a health checkup, and they said my liver levels were high. They mentioned it might be fatty liver, but when I looked online, I found there are many other possible diseases, and honestly, it scared me.
Yes, there are various causes of abnormal liver function. Fatty liver is one possibility, but there are other diseases to consider. Each disease has its own symptoms and causes, so let's go through them one by one.
Thank you. Your explanations are always so clear and helpful. I wish more people could benefit from your easy-to-understand medical explanations.
Thank you. We actually run a YouTube channel to share our information with a broader audience. If you find this content useful, I recommend subscribing to our channel. By subscribing, you can receive the latest health information and advice.
That sounds great. I just subscribed now. It was really easy to do.
Please don't forget to click the like button as well.
Sure, I just did.
Let's start by explaining viral hepatitis.
Viral hepatitis?
Viral hepatitis is inflammation of the liver caused by viruses, mainly hepatitis B and C viruses. Symptoms can include jaundice, fatigue, and loss of appetite.
I've been feeling more tired lately, and that's worrying me.
Next, let's discuss alcoholic liver disease.
What is alcoholic liver disease?
Alcoholic liver disease is caused by excessive alcohol consumption, starting with fat accumulation in the liver, which can progress to inflammation, cirrhosis, and liver cancer.
I have a friend who drinks a lot every night. This makes me worried for them.
Now, let's talk about non-alcoholic fatty liver disease.
Non-alcoholic fatty liver disease? Is it a condition for people who don't drink much alcohol?
Yes, that's correct. It's a disease where fat accumulates in the liver without alcohol consumption. It can progress to non-alcoholic steatohepatitis, cirrhosis, and eventually liver cancer if it gets worse.
So it's a more severe form of fatty liver. I need to visit the hospital before it gets that bad. I'll be careful.
Next, let's discuss cirrhosis.
What exactly is cirrhosis?
Cirrhosis is a condition where repeated inflammation and healing of liver cells lead to normal liver tissue being replaced by fibrous tissue. This reduces liver function and can cause various complications. It's said that the liver can't return to its normal state once it reaches this stage.
I don't want to get cirrhosis. This is getting scarier.
Next, let's talk about drug-induced liver injury.
What is drug-induced liver injury?
This occurs when certain medications or supplements have harmful effects on the liver. Even prescribed medications and supplements can cause drug-induced liver injury. The symptoms and severity depend on the type and amount of the substance taken, as well as individual susceptibility.
I didn't know that could happen.
Next, let's discuss gallstones and cholangitis.
I've heard of gallstones.
Gallstones are stones that form in the gallbladder or bile ducts. Cholangitis is an inflammation of the bile ducts. Both conditions can cause abnormal liver function and, if severe, symptoms like abdominal pain, jaundice, and fever.
People with gallstones must be worried.
Next, let's talk about tumors in the liver, gallbladder, bile ducts, and pancreas.
Can tumors cause elevated liver function levels?
Yes, benign and malignant tumors can form in these organs. Abnormal liver function tests can sometimes lead to the discovery of tumors. Advanced cases might be inoperable.
I've heard that cancers of the liver, gallbladder, bile ducts, and pancreas are hard to detect early. This is concerning.
Next, let's discuss autoimmune hepatitis and primary sclerosing cholangitis.
Autoimmune hepatitis and primary sclerosing cholangitis? I've never heard of them.
Autoimmune hepatitis is when the immune system mistakenly attacks the liver. Primary sclerosing cholangitis is a disease where the bile ducts become inflamed and gradually narrow or become blocked. Early diagnosis and treatment are crucial for both conditions.
So there are many causes of abnormal liver function beyond fatty liver.
Yes, if you have abnormal liver function, it's essential to get tested at a hospital.
Doctor, if I'm told I have abnormal liver function, what tests are needed to diagnose diseases other than fatty liver?
Good question. Several tests are used to determine the cause of abnormal liver function. We start with basic blood tests, but often more specific tests are needed.
Blood tests alone aren't enough to determine the cause. What other tests might be done?
For suspected viral hepatitis, we perform virus marker tests to check for antibodies or viral genes for hepatitis B and C. This confirms if there's an infection.
What about if alcohol is the cause?
For alcoholic liver disease, blood tests can show specific markers, but history of alcohol intake is crucial. Imaging tests like ultrasound, CT, or MRI may also be used.
What tests are done if a drug is suspected to be the cause?
For drug-induced liver injury, we review a list of recent medications. We investigate if any of these drugs are known to affect the liver. If necessary, a liver biopsy might be done.
What if a tumor is suspected?
For suspected tumors, imaging tests like ultrasound, CT, or MRI are performed to determine the nature, size, and location of the tumor. A biopsy might also be necessary.
What about autoimmune diseases?
For autoimmune hepatitis or primary sclerosing cholangitis, tests for specific autoantibodies are conducted to see if the immune system is attacking the liver. A liver biopsy might also be performed to assess the extent and type of damage.
Thank you for explaining in detail. These tests can help identify the cause and receive appropriate treatment.
Yes, that's crucial. Early identification and treatment can prevent disease progression. Feel free to reach out if you have any concerns.
Thank you. I'll make an effort to learn more about these diseases and focus on early detection and treatment.
That's the right approach. Regular health checkups and reviewing your lifestyle habits are key to early detection and prevention of these diseases.
Thank you, but, doctor, honestly, I'm very uncomfortable with hospitals and doctors. The thought of talking to a doctor makes my heart race.
I see, that must be tough. Finding a doctor you feel comfortable with can help. Checking out their website or YouTube channel before your visit might make you feel more at ease.
That's a good idea. I'll try visiting the hospital. Doctor, thank you. I'll continue to seek your advice.
Of course. Please watch our other YouTube videos as well.